Knock, knock, knock. Hi, my name is Ivy. I'm going to be your RN today. Can you tell me your name and your date of birth? Okay, perfect. All right. We're going to do some range of motion. I'm going to use some privacy to put on the curtain. I'm going to make sure the bed is at its lowest position. Make sure. Okay, but I'm just going to lift it up so that way we can do our range of motion together, okay? How are you doing today? Good. Good. How's your arm feeling? No, we're not. So we're going to just do range of motion on your unaffected arm, and we're going to do it on your legs, okay? All right, so we're just going to move these pillows. We're going to start with your head, okay? Just lift your head for me, too. Perfect. All right. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Lateral rotation. Lateral rotation. Lateral rotation. Lateral rotation. Lateral rotation. 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 Very good. Put it right under here. Good job. Relax. All right, let's start with your arm. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Abduction, adduction. Abduction, adduction. Abduction, adduction. Circumduction. 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 Internal rotation, external rotation. Internal rotation, external rotation. Internal rotation, external rotation. All right, facing palm up. Supination, pronation. Supination, pronation. Supination, pronation. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Adduction, abduction. Adduction, abduction. Adduction, abduction. Adduction, abduction. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Can you open your fingers and close for me? Good. Abduction, open, adduction, close. Abduction, open, adduction, close. One more. Abduction, open, adduction, close. Very good. Okay, turn around. You're going to have your thumb coming towards here. Good. Flexion, extension. Flexion, extension. Flexion, extension. Can you now touch your pinky with your thumb? Good. Opposition. 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 Very good. Okay, so we did shoulder, we did wrist. All right, we're now going to do your leg, okay? So just going to do here. All right. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Adduction, abduction. Adduction, abduction. Adduction, abduction. Circumduction, circumduction, circumduction. Very good. All right, let me put this up so that way I can do your feet. All right, ankles. Flexion, extension. Sorry, flexion, extension. Flexion, extension. Flexion, extension. Inversion, inversion, eversion. Inversion, eversion. Inversion, eversion. Inversion, eversion. Okay. Can you point your toes down? Good. Flexion, extension. Flexion, extension. Flexion, extension. One more. Flexion, extension. Now you're going to open your toes. Abduction, adduction. Abduction, adduction. Abduction, adduction. Very good. Okay, make sure we did lines, abduction. Internal rotation, external rotation, internal rotation. External rotation, internal rotation. External rotation, internal rotation. External rotation, internal rotation. Okay, very good. I'm going to go on the other side now, okay? Back up. Just want to make sure you don't fall. Get another injury because that would not be so fun, would it? Oh, you're welcome. I'm just going to put these two pillows so I'll give them right back to you. So bend your knee again. We're going to go flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. One more. Flexion, extension, hyperextension. Adduction, abduction. Adduction, abduction. One more. Adduction, abduction. Very good. Circumduction, circumduction, circumduction. Excellent. Internal rotation, external rotation. Internal rotation, external rotation. Internal rotation, external rotation. All right, we're going to do ankle. Extension, flexion. Extension, flexion. Extension, flexion. Very good. Eversion, no, inversion, eversion. Inversion, eversion. Inversion, eversion. Okay, you're going to curl your toes, flexion, and release, extension. Flexion, extension. Flexion, extension. One more. Flexion, extension. Can you open your toes? Abduction, adduction. Abduction, adduction. Abduction, adduction. One more. Abduction, exercise you can do at home. So for when your arm feels a little bit better, you're going to make sure you do the exercises you did over here. Okay, so you're going to do flexion, extension, hyperextension. Okay, so you want to make sure you do all those exercises. And then when you go back home to work on your trunk of your back, you're going to go down with flexion, stand up, extension, and then hyperextension. Okay, just a little bit. Don't go too crazy. Okay, you'll do that 3 times. All right. And then the other one you can do for your knee, you're going to bring your knee back, okay? Flexion and then release, extension. Flexion, extension. Flexion, extension. Okay? Right. Lower the spread. Sorry, let's see. Alright, we're going to make sure I have all your orders together. Okay, so we did your range of motion. Okay, and we didn't do it on your unaffected arm, and like I said, all the exercises you did on the right arm, you're going to do it on your left arm, all right? So what we're going to do now is we're going to have you sit on the bed commode, and we're going to put on a transfer belt. So I'm going to sit you all the way up to 90-degree angle, okay? All right, and then once we get you up, we're going to have you sit on the side of the bed. So I'll tell you when to go, okay? And I'm going to assist you. But I want to make sure if you have, I want to make sure if you feel any pain whatsoever, you let me know, okay? So that way we stop doing so. If there's anything uncomfortable, you let me know, okay? All right, so we're going to put on these slip socks on so we make sure that you don't slip and fall, okay? So what we're going to do is we're going to slide you over to the side, make sure your feet touch the floor. You can use your arm to grab onto the side rail, okay? So how about we start with that. Good, turn your body, and slowly put your feet, yeah, take your time. All right, just stay right on there, okay? I'm going to help you. Sit right on over here, okay? So as you stand up, you're just going to turn and sit, okay? And make sure, all right, when you're ready. We're going to count to 3. 1, 2, 3. Take your time, okay? If you want, you can grab onto my arm if you need assistance, okay? Ready? 3. Oh, hold on. Let's put on the transfer belt first. You want to make sure that you don't fall. Okay? I'm so sorry. Make it a lot easier for you to stand up. That's much better. It was on. It was on right. Fingers. Good. Right. So I'm going to grab onto my arm and I'm going to hold you from the belt, okay? Yep, that's fine. Okay, ready? I'm going to swing a little bit. 3, 2, and 1. Good job. All right, we're going to turn around together, okay? You're going to take your time, nice and easy, nice and easy. Good, let your back of your legs touch the seat. Does it touch it? Okay, perfect. Nice and easy. Take a seat. Beautiful. Okay? So I'm going to give you some resume right next, okay? And I'm going to let you know, just let me know when you need to use when you're done using the bathroom, and then we'll put you back on the chair, okay? So curtain closed, providing privacy to the patient. All done. All right, curtain open. All right, how was that? Good? Yeah. All right, we're going to put you back onto the bed so that way I can clean you all up, okay? Okay. All right. have you stand up, and as you stand up, I'm gonna do a quick wipe, okay? Make sure you're all nice and clean, okay? You ready? Grabbing onto my arm again. I'm gonna hold on to the transfer belt. 3, 2. Let's see if you actually might, if you can push off hard from the chair, and then you can grab onto my arm, okay? Okay. 3, 2, 1. Beautiful. All right. And we're gonna turn just a bit. Wait, okay. So are you okay standing? All right. I'm just gonna clean you up. Very good. Dirty towel or material on the floor. All right, and you're gonna hold on to me. We're gonna turn slowly. You can walk towards it. Stop. Which way? Walk towards the bed and turn slowly. Okay. So turn around. Beautiful. Until your legs touch the bed, and when you're ready, take a seat. Very good. Okay. Hold on to the railing. I'm gonna help you back up on the bed. Okay. All right. Very good. Okay. Would you like a pillow? Sure. All right. You can take a relax. All right. Is this a comfortable position, or would you like to lay down? Okay, perfect. All right, so I'm going to now calculate your urine. Okay. So no. Yeah, I can leave it. Okay, so mask on. Make sure no fluids go into my mouth. Goggles on. I'm going to now take the hat. I'm going to the bathroom. I'm going to pour it into a graduated cylinder. I'm going to place it right on the bathroom. I'm going to measure the urine output. It is 300 ml. Okay. I'm going to now empty the urine into the toilet. I'm going to rinse the the hat, and I'm going to rinse the cylinder. Okay. Place everything back. Okay, I'm going to discard my gloves. Perform hand hygiene, either washing your hands or hand sanitizer. But I'm going to just wash my hands. Yes. Okay. Hands are sanitized. And now I'm going to return to the patient's room. We are now going to get you some movement. We're going to walk around the room and help you, okay? I'm going to help you again like we did before with the transfer belt that I have on. And you're just going to take your time. We're just going to walk around, okay? And just do a little loop, all right? Do you have any questions? Okay, perfect. All right, so same thing. You're going to go and hold on to the side of the rail, put your feet on the floor, and we're going to take a nice and even walk, okay? All right, and if you have any questions, you let me know, okay? Go ahead, I'm going to help you. Perfect. Good. I'm going to help you with the belt. When you're ready, grab onto my arm. 3, 2, 1. Beautiful. Okay? Now we're going to walk nice and easy. Beautiful. We'll just go back around. Good. Just a little. Good. Very good. So turn around. Yep. And we're going to start heading back to the bed, just where we sat down. Okay? Very good. How does that feel? That feels nice to get out of the bed, right? Okay. All right, now sit back down. Good job. Take it easy. Make sure the back of your legs touch the bed. All right, nice and easy. Slowly sit. Beautiful. Hold on to the ground. I'm going to help you bring your legs up, and we're going to just turn. Good job. All right. Perfect. All right. So I helped Mrs. Tremont around the room for assistance. Now I'm going to make sure your bed is in the best position possible. Is there anything I can do to make you more comfortable? Do you want the bed lower? Is the pillow okay?
Yeah, this is okay.
Okay. Lower. I'm going to put a pillow under your arm so that way it's a little bit more comfortable for you, okay? How does that feel?
That's good.
Even though you're even, we're going to put this other pillow in your other arm and you can really be comfortable. Right.
Oh, look at that.
Yeah. Alright, so I'm going to go back and I'm going to document anything. Because I'm going to be out of the room, I'm going to give you the call bell. So if you need anything, you can call us, ring, and I'll be right with you when you need anything, okay? Can I get you any water or anything? Okay. I'm going to now document my assessments, my interventions, and my patient's response to my interventions. The alarm has been given to the patient for any further assistance. Okay. Wash my hands before I leave the room. Bed is at the lowest position, and